Greetings, everyone. I'm Paul Snyder, Vice President of Healthcare for Right to Market. We are an Atlanta-based digital marketing and public relations agency and the partner for this series of pediatric tech talks on behalf of Georgia Tech's Children's Healthcare of Atlanta Pediatric Technology Center. I'd like to thank everyone who's joined us today. Please allow me to thank and introduce our panelists. Leanne West is Chief Engineer of Pediatric Technologies at Georgia Tech. She is also president of the International Children's Advisory Network. Greetings once again, Leanne.
Thank you, Paul. And thanks everyone for joining us today. We really appreciate you taking time out of your day to listen to our Georgia Tech's Tech Talk. Today, we're going to be talking about how social media can play a role in mental health, whether it's good or it's bad. So we have two panelists today. One, Beth Minot, if she could introduce herself, and then Jessica Pater, if she could introduce herself. So we'll start with you, Beth.
Thanks, Leanne, and thanks, Paul. So I'm a Regents Professor of Computing at Georgia Tech, and that means I've been on the faculty 20 some odd years. My area of research is ubiquitous computing, which is, remember 20 some odd years ago, we didn't expect to have all these cell phones and tablets and all these wired devices and Internet of Things. And so I've been riding the curve of that innovation throughout my entire career. And for the past 10 to 15 years, it really focused on the implications for healthcare, and in particular, personal health. So health outside of the traditional healthcare system. I've done a lot of work in mobile technologies and technologies in the home.
Thanks. Jessica?
Hi, thanks. My name is Jessica Pater. I am a senior research scientist and manager of the Health Services and Informatics Research Group here at Parkview Health. Parkview Health is a large health system in Northeast Indiana and Northwest Ohio. And over the last 14 or 15 years, my research has really focused on understanding how technologies impact the daily lives of people, specifically youth and young adults. And in my current role, I've been here at Parkview for a little over 2 years. I've really focused on trying to connect digital traces of our behavior to actual presentation of disease, which is kind of why I'm here talking with you guys today.
Great, thank you. So Beth, I was wondering if you can kind of give a little bit of an overview about what kind of role computer science can play in healthcare.
So if we look at the role that computing can play in healthcare generally, and then maybe a little bit about mental health disorders, it really is about meeting people where they are. And I think this is a mantra of many aspects of healthcare, that you're meeting patients, people, families, caregivers, where they are in the midst of their daily life. And, you know, as it turns out, mobile devices like cell phones and then sensors like Fitbits, and devices in the home, well, that's where people are. So it gives us a platform to be able to engage people throughout their day-to-day life in comparison to the very actually small number of times that they're in a traditional healthcare setting. So if you look at this, you can think of what computers can do, right? So they can help you access information. They can help you find individuals who are like you. You can develop communities of support. They can be quite persuasive, and that's some of the things that we're gonna talk about today. But many of us focus on meeting people where they are, helping them set goals, helping them achieve the behavior change that's needed. A lot of us work in chronic disease management, and then also developing empathy. One of the programs that I work with that has nothing to do with what we're talking about today, but it focuses on people with mild cognitive impairment, so an early stage on the way to Alzheimer's and dementia. And just even that shared empathy of interacting with other adults going through the same thing can also be powerful. So, you know, in many ways, computing and its role in your everyday life can meet us in many places and provide that day-to-day pervasive constant support that is needed for achieving healthy behaviors and taking care of others.
Great, thank you. So Jessica, maybe you can tell us a little bit about what your work specifically focuses on. What conditions? Jessica may be frozen. Okay, so Beth, would you like to talk a little bit about what Jessica's work focuses on, what conditions she looks at?
Yep, and I'll Jessica, just wave when you're back, because I can see you smiling at all of this.
Oh, there she's back.
Okay,
Okay.
Jessica, go for it.
So Jessica, I was just asking what
Sorry about that.
Yeah. What conditions does your research focus on?
So over the past 7 or 8 years, my research is mainly focused on people with eating disorders, but eating disorders themselves are very complex and carry with them a lot of other comorbidities like depression, anxiety, self-harm, cyberbullying, those types of things. So we've looked at those throughout the last 10 to 15 years that I've been in this space, but a predominant amount has been in the eating disorder space.
Great. Okay. And so, we're talking here about what role social media can play in these disorders, whether it's good or it's bad. So what I wonder, and what I'm thinking a lot of people are wondering is, how do you get access to, say, their social media to look at it, to know how it's affecting them?
So that's a really great and complicated question. It's got a lot of different parts, but a high level is a lot of these platforms have what's called APIs, which is basically like a back door into the platform. So you enter into agreements with the platforms, you follow certain roles and procedures, and you can actually extract data. If people have set up their privacy in a way for it to be general or open, you can actually extract that quite easily with computer code. When platforms don't have those access points, it gets a little trickier. And a lot of my research in the last couple of years has focused on Instagram and Facebook, which means that we are going through and hand scraping data as to not violate terms of service, because it would be easy to write a program that would just crawl and scrape that information for us like a spider, bringing things back to a spider web. But there's a lot of kind of ethical and policy things that kind of collect the data. And a lot of times the patients we've been working with actually give us access to their data. So we set up, researcher accounts, and then, that's how we have access into their full kind of history. So the answer is a lot of different ways, but if you have an open account, your data is probably in some data set somewhere that someone's researching. And that's something that our patients have all felt very, confused by, is why we would want to look at their social media. Like, why do we care about them? And the answer is because of the things we're talking about today, right? Is because we're trying to look for signals within their data of if they're at risk, or if there's harm going on, or if if we can target potential help or targeted education to them, right? So it's kind of still, the wild west with some of these new platforms like TikTok and Snapchat, where we can't really collect that type of data, but there are very smart people all over the place figuring out those, barriers and figuring out how to get to that data probably as we speak.
Yes, I'm sure there are. So I know you said you've looked at things like, is there self-harm going on, or things like that. What all can you really see from somebody's social media?
And Jess, let me do the first. I'll do one half of that cup and you do the other.
Okay.
All right. So, because I think it may help for folks to ground folks into kind of the overall premise of how this works. And the gist is that if you were thinking about trying to diagnose or understand someone's mental health disorder, you would want to know about their behavior, right? You could look at their behavior, what they do day in, day out, how they converse with family and friends, how they're spending their time. Are they up in the middle of the night? Are they using language that denotes anxiety? All of these are kind of behavioral cues that you would pay attention to, right? And if you're a family member, you're kind of keeping an eye out for someone, or if you're a clinician, you're using surveys or interviews, patient consults to really understand what's going on with the person, so that then you can get a sense as to, a diagnosis or treatment or further consultation. So take all of those kinds of questions And then understand that what we're doing with computers is that we essentially have a lot of breadcrumbs of people's behavior that is out there, right? So when people are posting on social media, whether it's Facebook, because I'm old generation, so I'm on Facebook, or Instagram, which of course is what my kids are on, right? They're posting things, and they're choosing images, and they're using certain language, and they're tagging it, which means marking it for other people to see in certain ways. All of these are clues. They're doing it at certain times of the day. They may be doing it repeatedly or only once in a while. And even understanding how other bits or clues of how other people, like how Leanne's looking at what I post, and vice versa. Mm-hmm. So these are all breadcrumbs that are out there. They're out there as unintentional signals. Right. And so in many ways, and they're incomplete. And of course, any analysis of someone's behavior is incomplete, but they give us clues. And so computer scientists, we love data, right? We love looking at these bits of data that are all over the internet. And so we will ask questions like, is the language that someone is using, right? Does that denote something? And it can be in the language they use, in the words they choose. It can even be first person versus third person references. There's all sorts of clues that are in that that we use. And so there's been great excitement in our field that once you give us some data, a bunch of us will jump in with both feet and say, hey, what can we figure out? And so you'll see a great deal of research that's out there. Can we recognize depression, postpartum depression? Can we recognize PTSD? Can we recognize disordered eating behaviors? All of these are potential insights that we try to glean from incomplete breadcrumbs of people's day-to-day behavior. So that's the goal. And then Jessica is going to talk to us about the reality of what it means to try to do that and what we think we can do.
Right. So that's great, Beth. And I think also things that we are starting to look at as well is who people are following, what kind of, and what kind of influences they have, not just kind of what they're putting out. Because one of the things that in some of the research Beth and I have done together is really trying to ground these incomplete online signals with patients, with real people, and to get their perspective of what that means. Because of the partnership with Parkview, we also had access to physicians and their health records. So we could create this kind of, we could triangulate between their first person accounts, their medical records, and then what we were able to do with their social media data to try to kind of create what was the impact of social media or technology, not just social media. Beth brought up Fitbits earlier, which is really important. And those type of trackers are really being misused by people with eating disorders, much more than I think we really talk about. But how do all of these technologies play a role in that, in their disease presentation? And I can tell you that all of the patients that I've talked to in depth about their use of technology, they're not creating these cues, right? They're not creating posts that would signal that would knock you over the head signal like, wow, Jessica has an eating disorder. She's posting some really provocative pictures of like her starting weight and where I'm at now, or, my dreams or aspirations of being thinner or whatever, those might be, but they're consuming this content that is online, that is very explicit. So when Beth was mentioning that kind of frequency of post and that interpersonal where, if I'm talking and including myself in my communication with the world via my social media, and then I stop doing that and I become more detached from that. That was a sign that we found in our last study that was really more of a telling aspect than, say, the language they were using or the accounts that they were following or things like that. So it gets really complicated in trying to connect these subtle cues with some of these larger things that we know within their health record or things that they are discussing with us in interviews. And I think that, that type of mixed method study of taking that raw data that we can connect, but then putting that human spin and understanding that the patient's perspective was really important for us, and I think really opened our eyes up to some of those more latent, those more subtle cues that we weren't really seeing when we were looking at large public data sets that we really couldn't connect to the patient.
Yeah, that's really interesting. And I agree that it's really important to include the patient in this kind of study so you can really get a bigger picture about what's going on with them. So the title of this talk was about the good and the bad of social media and these types of things. So can you tell us a little bit about, I think some of the bad is obvious, right, with the way people reply and how people take it. But maybe you can expand a little bit on the kind of the bad that you saw in your research.
So the bad that we saw was a lot of pro-disease support, right? So when we think about online support, we usually think about that as like helpful support groups and things that really make us support us through challenging times. But what we found was this kind of subculture of patients that were saying that eating disorders aren't a disease, but this is a valid lifestyle. And, yes, you should skip dinner so you wake up thinner, and really like turning those kind of positive cues in a pro-disease state, because they have a vested interest, right? And this is a valid lifestyle for me, it's a valid lifestyle for others, and where do I gain support in that? Because it's hard, right, to kind of maintain that lifestyle, and to hurt yourself in those ways. And so that was one of the biggest things we saw, was those kind of pro-disease support communities. The other is just the amount of imagery and iconography that's attached to this community. So a lot of very suggestive images, taking images and video and interlacing that with music and artwork and things that are potentially more persuasive than just text. So we see a lot of Instagram and Tumblr versus kind of Twitter and Facebook, right? Because it's easier to kind of be anonymous on those platforms if you want to be, and just the centering of that around images and video, I think, were really where we saw a lot more of the damaging and destructive kind of connections for individuals with one another.
And Leanne, to follow up on that, I think part of what is a now parent of teenagers, part of what I saw that was distressing to me was just how easy it was to go down a rabbit hole of content and the normalizing effect it has. So, in the patient-facing work that Jess did and some of the other things that we have seen, the first internet search might be just how to lose a couple more pounds. It might be part of an overall fitness goal. It might be because some boyfriend who I wouldn't agree with, but is like, oh, my boyfriend thinks I should lose weight, right? Could be some sort of pressure, but it's not an eating disorder. Right. And then you go into what becomes a progressive rabbit hole of content of other people embracing this lifestyle, posting motivational content. And, we could think of motivational content as, again, that social support that helps you get through a hard time. But the same sort of motivational content can be motivating you to disordered behavior. And then that becomes normalizing. And so one of the things I saw over and over again in the interview content was, oh, well, this must be okay because so many other people are doing it, or there's people that are way worse than I am about this. As long as I'm in the middle, it's okay. And so we're used to this normalizing effect to be your local friends and neighbors and who you're in school and church and contact with. But the internet creates this different kind of normalizing ecology that then folks are using to change their attitude about what makes sense for their day-to-day lives.
And I think too, Beth, that normalization, I think another important thing we saw was that, in the early 2000s up until kind of the 2010, most of these communities were in online dedicated like websites or dedicated online communities. But with the rise in popularity of Facebook and Twitter and other platforms, these things are integrated into these larger communities. So it's easier for them to kind of hide in plain sight. Like, if this was happening in 2005, you could set up a filter on your ISP to like look at the web traffic and see what websites your kids were going to. But if I'm just going to Facebook or I'm just going to Instagram, right, it's harder for some of the more traditional methods of identification of where people are going to really be possible. And by integrating it into platforms that you use on a daily basis, you're more inclined to be on those platforms more and switching and engaging that content.
Okay. So what about the good? I think you've said that there's some good that can come out of it too, that social media can play with these kind of disorders. What do you see there?
So I see that the support community has really like tagged and like figured out what channels and kind of the terminology that is being used by these communities, and using that to infiltrate and kind of share support resources and to share, numbers that you can call, groups in local areas or nationally that you can reach out to support. So that would be one way of, so using the tagging that Beth was talking about earlier, whereas people were tagging that for inappropriate content, really starting to integrate the supportive, as well as we've seen in the last year with COVID, just having online support groups, right? Mental health, access to mental health is a problem in this country. And by having these kind of support groups online, it gives access to people that might not have, by where they live or money, you don't see, they might not have, the ability to go into a clinic and to be seen. And we've seen Facebook groups be a really large part of that. There's lots of support groups on Facebook. And there's lots of kind of social media campaigns to kind of get, news out about things. So those are kind of how I've seen the support community kind of operationalizing in this space.
And again, back to that computer science goal of if the behavior is out there, can we detect it, right? So, one of the things that we're interested in is, in mental health, but especially just in primary health, right? What information can help physicians and nurses, clinicians, to be even just to get a glimpse that maybe there's something that's of concern here, right? Can it have a detection role? Because these disorders, they hide. A quick clinical encounter might not be sufficient, but are there the kinds of questions that you can ask, or the kinds of data that you could look at, which would give you a hint just to go a little bit further and maybe intercept a problem before it's full blown.
Yeah. And so speaking of clinicians, what do you really see as their role in this? I don't think that they would have access to the patient's social media, for example. What kind of things could the clinician do to understand that child a little bit better, or person?
So I think one of the things is just talking about it, asking specifically about it, right? So in some of my interviews with providers, we traditionally, our tools and through our initial assessments and ongoing assessments, we ask about influences, but we don't really call out online influences or online spaces as a component. I think we tend to think about things that happen online as a singular event or something, or not something that is more consistent. I've seen that in some of the cyberbullying work as well. So I think that, just asking about the online influences, and the things that we ask about, like, TV influences or magazines or friends, asking about online platforms or social media platforms could be a really easy but really important first step in engaging and starting that conversation.
And one of the other things that we saw, and again, our data is initial data, right? There's so much more research that needs to be done,
Right.
but even asking about what kind of apps, folks are using for fitness. We saw what I would informally describe as, compulsive use of some of these tools that are out there that, go from being, an occasional way of trying to, keep track of your workouts to, maximizing workouts versus calorie consumption, and again, just kind of lighting the flame on some of these behaviors. And so that is something that can be surveyed, which is, just, what kind of apps are you using for fitness and your health and nutrition, and, how often are you using them? And, a couple times a week as opposed to a couple times a day gives you a sense as to, where there may be a problem lurking.
Yeah, okay. I think that's good. And I think that that's helpful advice to clinicians out there who are listening. One last question, since we have about 5 minutes left, is how do you feel about new social media platforms coming online like TikTok? Do you think they're going to make things better or worse, or it's just another tool out there?
So I don't think that they're going to make things either, I think, better or worse. I think it's just another example of media that's, rich in imagery, that can be used to kind of exacerbate mental illness. And so we're starting to see, like, notions of that from self-image and eating disorders and some of the intensive outpatient therapies that we're running here. But it's no different than kind of what we were seeing with Snapchat when Snapchat came on board, right? And when Instagram came on board, it's kind of, we have these new platforms and these same behaviors, getting back to kind of how Beth kind of set up the talk earlier. It's all about those behaviors. So if we're not addressing those core behaviors, we're just going to see a transference into the newest technology, regardless of the kind of safety, the safe holds, or the design of those technologies. They're always going to be perverting those or manipulating those technologies to meet their needs if we're not addressing those core behaviors and the core illnesses.
Yeah, so I actually have one more question. If you're looking at this, and I'm a person who's using social media, do you see one day, I know social media right now, it will send you advertisements for things that, they think you want because you've done a search, or you've spoken about it. Do you see social media owners doing something like that, where they have maybe an algorithm that's running in the background to try to help catch if someone is depressed or is having anxiety or is facing an eating disorder, to maybe send them information even privately to say, hey, if this is an issue, please call?
So we have already seen that, right? We've seen platforms like Instagram, if you use certain terms like finspiration or pro-ana, which would mean you're pro-anorexic, that if you try to post in those using those terms, they actually will put up a light intervention saying, hey, it looks like you're using words that indicate you might have a problem with eating disorders. Here's a national hotline. But then again, if you want to click through here to your content, right, which is in like super small script at the bottom corner where they're hoping you don't recognize it. So we're seeing things like that. But I think that, I think we're going to see more things like that. But what we've seen is that people are smart, right? And we've seen this community in the middle of us doing research, shift their practices, the kind of social engineering to get around these implements that the platforms are using, so that they don't have to be bothered with those. So as we build the smarter device, we're just going to breed smarter people to get around some of the things that they don't want to engage. But I do think that you mentioned the ads, and that's a really complex thing, right? Because it can, without the platforms really knowing, have really negative impacts on people in different mental states. So I think we'll continue to see those, but I think there's a lot of ethical and a lot of policy components that also have to come into play there for those to be effective and for those to actually take hold more than they have so far.
Okay, so thank you both. Jessica, I know we have some resources if anybody in the viewing audience may want to learn a little bit more, you're going to share your screen. And I'll just ask, are there any questions from anybody in the audience that we've received?
There was one regarding what can the clinicians do that I think y'all covered very well. So we anticipated that nicely, and I just would say well done. So have back at it, Leanne.
Great. So Beth and Jessica, thanks so much for sharing your research with us. I think this was really interesting, and I hope it was maybe helpful to some people out there listening. We will have this recording on our Georgia Tech website, the Pediatric Technology Center website. We also will have our next Tech Talk on April 21st at noon with Jaydev Desai, and he's going to be talking to us about medical robotics. All super interesting. The robotics that he particularly works in medicine are brain surgery tools. So please join us for that. And we'll have 2 more the rest of the year. And we hope that you're able to join us. So thanks, everyone.
Thanks, Leanne. Appreciate the opportunity.
Thank you, Beth. Thank you, Jessica. Thank you, Paul.
You're welcome. Everyone, take care.
All right.